let's talk to an expert, Paul Seegert, uniquely qualified to discuss these issues. He's managing partner at PCS Advisors, and that's a benefits consulting firm. And I guess they've got like 35 partner offices across the country. Mr. Seegert, thanks for being with me. How you doing?
Doing great. How are you today?
I'm doing okay. The what ifs just go on and on and on for days, evidently. But basically, a lot of these companies are saying, okay, well, if we're located in a state, you're working in a state that does not provide for abortion, somehow, some way, we're going to reimburse you or we're going to give you a stipend. I mean, how's that work out? I mean, does that put them in legal jeopardy in their respective states? How does that work?
Well, it could, and it's going to be a really interesting coming few months and probably even a few years as this gets sorted out state by state in the courts, I would expect. But what we're dealing with, at least right now, is that you have large employers, most of whom had health plans that did cover abortion services, who are saying they want to continue to cover these services.
Right.
And if you're in a state that where that's no longer available, then they're going to make travel and lodging expenses covered. Dick's Sporting Goods said they'll cover up to $4,000 of travel and lodging expenses for someone to get these services in another state if it's not available in the state where in their home state. So it's going to be an interesting thing to watch. It's full of potential issues, tax implications, even down to the employee level, who may get some tax implications for that sizable travel benefit.
What do you see
treated as income?
Exactly. What do you see as the primary focus, the biggest problem for an employer? Now, let's say you and I have a company here in Dallas, and of course we know now with the overturn of Roe v. Wade, abortion's no longer available to those that seek it. And we sit down at the end of the day and say, okay, how do we figure this out? Do we make it part of a benefit? Do we try to get an arm's length distance for possible legal ramifications? At what point do you say, okay, here's what we're going to do, and then we're walking away?
Yeah, I think there will be multiple classes of employers when it comes to this, based in part on size. If you're a larger employer, you have a health plan. Likely you have a self-funded health plan that's governed by ERISA at the federal level, and
right.
You're not subject to state laws or state governance, let's say, of your plan. So that's where some of these larger employers are already coming out saying, hey, because they've been preparing for this likelihood. They've been getting legal advice and advice from insurers and so on as to what their options are. So they're coming out saying, hey, we can still cover it in our plan. We're just going to have to make it possible to reimburse you for travel. Then you're going to have employers who are purchasing a health plan within that state provided by an insurer within that state. And let's suppose you're in a state where it's not available. Now, those health plans, that smaller employer buying a health plan in that state isn't really necessarily going to have the same options. Their health plan very likely is not going to cover it. So I think there's going to be some interesting unintended consequences in how this affects that hiring disadvantage that already exists between large and small employers for those for whom this is important. You've got cultural issues. There's really no good direction for an employer culturally. Somebody will be upset no matter what the policy is that they come forward with.
And that's what, at least in my mind, that's what happens when politics overlaps into, a benefits package when you go to work for someone. Used to be just that, a benefit package. Right. You didn't have to stake out what camp you're going to be in based on whatever issue it happens to be. As I look at this, where I come down on this is going to put an awful lot of lawyers to work.
It sure is. It sure is. I mean, there is potential liability up to the director level and C level at these employers. And I think they're taking this action, these larger employers, north of 20,000 employees. Virtually they all provided coverage for this in the past and
right.
are indicating that they would like to continue to do that. I think they're doing that knowing full well that they will face lawsuits to do it, and that could even be a state-by-state thing.
Yeah, I just, as I look at this, looking in the big picture, not into the individual specifics, this is such a emotionally charged issue. You wonder how it even came to be a part of the benefits package in the first place. I guess you have to really believe that, ending a pregnancy is a health issue. And evidently a lot of people have. What if a company just says, you know what? I'm done with this. I don't need the protest. I don't need the cancel from the woke mob. I don't need any of this. Here's your benefit. And it's for normal health care cost, and maybe a small life insurance policy as well. I think those days are pretty much gone, aren't they?
Yeah, they're being forced to take a position. Even as you go back a couple of years, 2019, Kaiser Family Foundation did a study on it, and 9 out of 10 employers at that time had a plan that covered abortion services. So the vast majority did. And then you had 10%, of course, the balance that chose not to. And it was already pretty overwhelming in that way.
Yeah.
You are being forced to take a position.
You think more and more companies in the coming weeks and months are going to be jumping on this?
I do. In June, leading up to this decision this month, 14% already had put some sort of travel benefit in place, and another 25% are saying in a recent Mercer survey that they too will do that. These tend to be the larger employers, but I do think this is going to be more and more common. I think they're going to have to tread it's going to be a careful line to tread. You're trying to alienate as few as possible.
Right. And you're going to alienate some no matter what you do.
Exactly right. And so a lot of the policies, the way they're being written is they aren't specifically for only this one service. It may say for health services not available in your home state.
Yeah.
That kind of thing, so that they can kind of try and walk the line.
Yeah, that's exactly how it's going to be framed because, again, you're trying to attend to the sensibilities of all employees, and as neutral as Switzerland as you can be on this and still get the job done is probably what these large companies are looking for, right?
Yeah, exactly right. I mean, they're in the toughest hiring environment they've been in before all this happened. They were in the toughest hiring environment they've been in 15 years. And now you add this into the mix, and it's already an employees market right now.
Wow.
And that may change as we head into tougher headwinds economically, but for now it's still employees have the upper hand. And it's not inconceivable to me that some of them may ask about this and make employment decisions around it.
I think you're absolutely right. Listen, Paul Seegert, managing partner at PCS Advisors, I appreciate you taking some time out and discussing this with us.